merciful God. Thank you for this program that you have inspired the team to put on. I pray, eternal God, that the lessons we may learn this evening, it may do us good. Help us, oh Father God, not to turn our backs on good advice, but as good people we may follow where you lead, because we know you lead us into righteousness. Thank you, oh God, for hearing and answering our prayers, I pray. In Jesus' name, amen.
You may be seated. Just want to welcome our friends. We have some lovely gentlemen around the back there. They are brothers. And one of my brother told me that he's from Spanish Town. And they are passing by and they stopped to worship with us at AY. Could we give them a big amen? Happy to have you, brothers. It's not your first time at Spur Tree, right? But we welcome you back and we hope to see you again very soon, right? So I am so happy to see you, gentlemen, because our first presenter will be talking about prostate health. And all men have prostate. No, women don't have prostate, but men do, right? And although we don't have prostate, as was said this morning by Sister Price, we have brothers, we have sons, we have husbands, we have cousins and uncles, and we have family members who are male. So we need to know about, we need to be knowledgeable ourselves so that we can encourage them, and we can do things, to help to protect their prostate health, right? And this month, September, is celebrated as Prostate Cancer Awareness Month. Did you know that? Yes, so you have a lot of celebration in the month. One of the main activities is prostate cancer awareness. And during September, you're advised to wear blue. So I don't know if it's coincident or not, but quite a number of us today are wearing blue. So it's also celebrated as Childhood Cancer Awareness Month, right? And the color for that is yellow. But today we're focusing on the blue side, right, Sister Jones? Focusing on the blue side. I have with us this afternoon Dr. John Newman, and he's here with his family. Family, could you give us a wave? Yes, his family is here supporting him. And he will be presenting to us about prostate health. He's a medical officer of health at the Mandeville Comprehensive Health Center. He's not new to Spur Tree. He has been here before in several capacity. And I'm sure that Dr. Newman has something very special for us. And at this time, I'll invite Dr. Newman to come and do a presentation. But before he comes, I'm going to invite the Williams family to give us a special rendition, after which Dr. Newman will do his presentation.
There is coming a day when shall see when I look upon his face, the one who saves me by his grace. When he takes me by the hand and leads me to the promised land. What a day, glorious day that will be.
There'll be no more sorrows there, and no more burdens to bear, no more sickness and no more pain, no more parting over there.
Then forever I will be with the one who died for me. What a day, glorious day that will be. What a day that will be when my Jesus I shall see. When I look upon his face, the one who saved me by his grace. When he takes me by the hand and leads me to the promised land. What a day, glorious day that will be. What a day, glorious day that will be. That will be.
Thank you, and good afternoon and happy Sabbath. Thanks for the invitation. Coming here. I've not been here in a couple of years, and that's kind of too long. I keep promising that I'm coming and can't seem to reach. But it's good when you have an invitation because it forces you to come. Now, what a day that will be when, as a physician, I'll have no more need of my stethoscope. I can throw it away. And all the instruments that we use, we can toss them, because there'll be no more need for any of those things. Sickness and sorrow, all those things will be things of the past, and we look forward to that day. All right. It's really difficult for me to talk about prostate health in general in 30 minutes. So we're kind of zeroing in on prostate cancer, but some other aspects of prostate health will come up as we go through. And you were told earlier that the color is blue. Each disease have their color. You know, breast color is what? Pink, breast cancer. Oral health is burgundy. Wow. You know, each has its colors. So today we're looking at prostate cancer. All right, let me make sure I get this. You know, that just reminded me of an experience I had years ago, where we sold an instrument to a company, and they called us to tell us that the thing wasn't working and we should come and take it out. And when we went there, they had not connected the power. So here I was trying to do this clicker thing and didn't realize that I had turned it off. All right, prostate cancer. I always like to use this text in my health presentations. It's a promise that was given to Israel when they left Egypt. And we can read it together. If thou wilt diligently hearken to the voice of the Lord thy God, and will do that which is right in his sight, and will give ear to his commandments, and keep his statutes, I will put none of these diseases upon thee, which I have brought upon the Egyptians, for I am the Lord thy God, that healeth thee. Now, interestingly, archaeologists, those people who dig up bones and study those bones, they have discovered that the Egyptians suffered from many of the diseases that we have in our current lifetime, our era. So cancers, arthritis, heart disease, stroke, diabetes, all of these things were common back in the time of Egypt. So we might just be looking at this text and thinking that it was just referring to the plagues. And God was saying that I will not put any of those plagues on you, no. He said, I will put none of these diseases. And he gave them, well, when he took them out of Egypt, he gave them a special diet, which they didn't quite like, and they murmured about it. But if they had accepted the diet that God had provided for them, things would have turned out a whole lot better. They would not have gotten discouraged at the border and have to walk around for 40 years, wandering around, but they would have made it in the time that God had ordained for them to reach their destination. So this evening we're going to look quickly on what is the prostate, what's its purpose, what's prostate cancer, how big a problem prostate cancer is, what are some of the risk factors for prostate cancer, some of the symptoms, and how can we detect it early, and finally, prevention strategies. All right, so well, the color is a little washed out, but this is a cutaway view of the male anatomy. So this here is the bladder, here is the rectum, that's where the stool comes from. Well, the testicles would be here, that's the penile shaft here. And this thing right here, that looks like, almost like an avocado upside down, that is the prostate. And this tube that goes through the prostate is the prostatic urethra. And that takes urine from the bladder out to the penis and into the toilet or wherever. No. I can say that for men. And interestingly, I saw one presentation some time ago, and they were talking about prostate health. And the whole controversy about, gender fluidity came up. And one person in the comment stated that the speaker should have defined exactly what man means. Now, we're talking about persons who have XY chromosomes. All right, if you have XY chromosomes, it makes you a man. And you'll have a prostate unless you have some genetic problem that causes you to be born without one. But the males will have prostate. Now, it is often likened to a walnut. But many of us in Jamaica would know what a walnut is. So what I did was to draw something in my hand to give you a picture of it. So it looks almost like a heart, It's about 4 centimeters, which is about 1.5 inches across. No, 4 centimeters. Let me see now. Yeah, 4 centimeters across, 3 centimeters in height, and in depth, which would be a slice from the top here, it's about 2 centimeters. So that is how it looks right here. And if we were to cut through here, we would get a picture that looks like that. And the prostatic urethra, where the urine comes through, passes right through the center there. All right, that's a closer view. So we can see the prostate and the urethra going through there. And the fact that the urethra passes through the prostate is helps you to understand the symptoms that men can have when the prostate starts giving trouble. And one of the common problems is going to be with the passage of urine, because the urine has to go through the center of the prostate. All right? Functions of the prostate. I did a presentation some years ago, and a gentleman raised his hand and asked a question: why God made us with a prostate? Just to give us problems. To ask that question would be like asking why God made women with breasts. They have a purpose. Yes, you can get breast cancer, but they serve a purpose. And the prostate serves a special purpose too. It's part of the male reproductive system. It secretes prostatic fluid, which forms 30% of the final semen, the ejaculate. Now, prostatic fluid contains some secretory proteins and electrolytes and glucose, and we know glucose is for energy, some zinc and some citrate. And what the prostatic fluid is responsible for is nourishing the sperms as they take their travel, their journey, hunting down the egg that they will fertilize. Now, one other thing about the prostatic fluid is that it creates an alkaline environment, because the female genital tract tends to be acidic. So if the sperms were to fall into this acidic environment, it would hurt them. So God made the prostatic fluid so that it creates a nice, healthy river for them to swim in as they make their journey. All right, what's cancer in general before we look at prostate cancer? So normally when you're growing and your cells are dividing, the cells are programmed in such a way that they grow to a certain size and stop. And they grow to a certain boundary and stop. If that did not happen, then your hands would continue to grow. Your tongue would continue to grow. And we know there are some parts that, let's say, continue to grow, like the nose and the ears. As you get older, the nose gets bigger and the ears gets bigger. But that's just normal. Now, sometimes things can go wrong in the cell with the instructions and cause these cells to grow out of control. So they no longer respect any boundaries. They no longer respect the fact that we are insufficient numbers, so we should stop growing and stop dividing. They don't respond to anything like that. So they begin to grow out of control. And one of the things that is common with cancers is that not only do these cells grow out of control, but they break through barriers and end up in places where they don't belong. And the fancy term for that is metastasis. So when the doctor says the cancer has metastasized, it means that it has spread from where it originally developed to some other place. And prostate cancer loves to spread to the bones. And we'll see one of the symptoms a little later on. So if you realize here, that's normal. Over here, the cells are a little more in number. We call that hyperplasia. But then here, everything begins to look distorted. that means that there's some damage going on and you're heading to potential cancer. Then when you get to cancer now, this barrier is no longer respected and the cells just begin to grow and grow and grow and cause problems. And we know that growing cells demand energy, and that's why cancers will tend to cause you to lose weight, because all the energy that is meant for your body, the cancer will be there literally sucking it and sucking you dry. All right. A little more about the function of the prostate. We said that there were some proteins in the prostate. And one of the important ones is the prostate-specific antigen, the PSA. And everybody inside here should have heard that term used, the PSA. So the PSA is a special protein that has this ability to liquefy the ejaculate, the semen. If you did not have the PSA, what comes out of the penis would be like jello. It wouldn't go anywhere. It would just literally just fall like a glob. But having the PSA, it liquefies that so that the sperm cells can have a river in summer to swim in instead of a river in winter. All right, let me just go on here. So how big a problem is prostate cancer? If we look at, this is all cancers in both male and female. Here is every other cancer that is not listed, like the minor ones. But if you look here, prostate cancer would be the second leading cause of cancers in the general population. And breast cancer comes in third. If we look at it now from a male perspective, let me see if I can get this thing to, okay. All right, so that's from a male perspective. That's prostate cancer. That's the percentage of prostate cancer in the male population compared to all other cancers. And you realize that's a large chunk. That represents, you can't see it on the board, it's very, very small, 43.1%. And colon cancer comes in second or third, depending on which of the studies you look at. All right, so prostate cancer is a public health burden because it's the second leading cause of cancer and cancer deaths in both genders. If we look at the general population, and the number one leading cause of cancers and cancer death in men. It's a burden, and yet it's one of the cancers that you can easily detect and detect early, because the silver lining is that prostate cancer tends to grow very slow. So if men were to do their follow-up every year and get tested, 100% of men, literally, would pick up the prostate cancer when it's at a stage when it can be treated easily, not when it has spread to distant places. What are some of the risk factors? Genes and environment. Most of the diseases, the lifestyle diseases that we know about, there are two big factors that will influence your risk of having these diseases. So even high blood pressure and diabetes, the risks are categorized in two: genes and environment. So genes are what you inherit from your parents. So if your father had prostate cancer, and your uncle had prostate cancer, and your older brother had prostate cancer, then you need to really follow up, because your risk of developing prostate cancer is very high, because it means that there is some genetic predisposition that is passed down through all the males in the family, right? But as they say, genetics loads the gun, but environment is what pulls the trigger. So the fact that everybody in the family has a certain disease does not mean that you are condemned to have the disease. And I have seen patients where both sides of the family have diabetes, and they're the only one in that family without diabetes. Yeah. Because they realized that they needed to change their lifestyle from early so that this curse would not fall upon them. All right, so genetics loads the gun, but the way how we live will determine how the genes play out. Now, the risk of prostate cancer increases with age, and it starts from age 40, approximately. But we know that even Ben Carson had prostate cancer before he was 40. Unfortunate for him that he was testing before he was 40. And I think one of the reasons why he would have done that is because prostate cancer risk is higher in the black population than in the Caucasians. And the Caribbean is off the charts when it comes to prostate cancer. And you can know where Jamaica is. Jamaica is right up there leading the pack when it comes to prostate cancer. So as you get older, your risk of prostate cancer increases. So from 40, you have like about 8% chance of getting prostate cancer. But by the time you get to about 80 years old, then you have a chance of about 80% of getting prostate cancer. So there isn't a point where you can stop screening and say, okay, since my PSA has been good, I can just forget about screening. Because 5 years might pass and things might creep up on you. All right, we said race. So blacks are higher incidence and family history. Once you have someone in your family, then it puts you at risk. Dietary factors, some of the risk factors. So there is a twofold increased risk with diet high in saturated animal fats and trans fats. So trans fats are fats that have been exposed to heat and have been distorted. So they become very pro-inflammatory. And if they create an inflammatory environment in your body, it increases your risk for cancers in general, including prostate cancer. All right, so red meat, a lot of calcium, which is not very common because we tend to be more calcium deficient than anything else. But low vitamin C because we don't eat our fruits, vitamin D because we don't get enough sunlight, and vitamin E because we don't eat a lot of nuts and grains. Now you can get them from plant products, from animal products rather, like your tuna, fishes. You get your vitamin E from those. But if you want them from non-animal products, then your nuts and your grains will be high in those things. All right, low zinc in your diet. Zinc is very important. We saw that the seminal fluid that's produced by the, not the seminal fluid, the prostatic fluid contains a lot of zinc. Zinc is important for prostate health. So if your zinc level is low, your zinc intake is low, then it increases your risk for prostate cancer. Low intake of lycopene, and lycopene is the red pigment that is in your tomatoes, your papayas, your guavas, the pink guavas, what else? Your pink grapefruit. Oh, wow. This thing is quite sensitive. Yeah, so it's that red pigment. Now, lycopene is an anti-inflammatory agent, so it reduces inflammation in the body. But it also blocks the conversion of testosterone from the non-active form to the active form. And male-related cancers like prostate cancer will be influenced by an environment that is rich in testosterone. So it's dangerous when men are taking testosterone supplements, in addition to the testosterone that you produce, you are increasing your risk. But if your diet is rich in lycopene, like you eat a lot of tomato paste, and it's best if you make your own tomato paste, not the one that has high fructose corn syrup in it. Make your own. That gives you a lot of lycopene. And when you put your guavas and other things with the red pigment, it is very beneficial. Low omega-3 fatty acids, and this comes, you get it from cod liver oil. But if you don't want to eat oil coming from fish liver, you can always get it from your chia seeds and flax seeds and walnuts. Most of the nuts, Brazil nuts, those are rich in these minerals. Low selenium, and selenium is also good for the prostate, and most of the seeds that we mentioned already will be rich in selenium. Low vegetable intake and low dietary fiber. Being overweight puts you at risk for prostate cancer. And as I said before, if you have high testosterone, if you're taking testosterone supplement, that puts you at risk. If you're diabetic, if you have type 2 diabetes, which tend to be associated with insulin resistance, it causes you to have a high level of insulin in your body. And insulin is a growth factor which can stimulate the prostate cells to grow and possibly to grow out of control. Other issues, poor colonic health, constipation, and high stress lifestyle. All right, that chart is going to be too small for you to see. But most of what I have mentioned a while ago, it's there. And if you want the presentation, you can always ask and we can give it to you. All right, so we have looked at the function of the prostate and would say it's vital for reproductive health. So without your prostate, men, you would not be fathers. Simple put. All right? So don't point finger at God and say, why God give me this thing to give me trouble. All right? Very vital. Just look at your kids and smile and say, God, thanks for the prostate. All I need to do is just to take care of myself and follow up with my doctor so that things will be well. We have looked at some of the risk factors, and we said age and race are risk factors. Your diet has a role to play. Now we're going to ask the question, what are some of the signs and symptoms that you might have prostate cancer? Now, in the very early stage, there are no specific symptoms. And that is why men who sit and wait for symptoms, when they finally have symptoms and they are diagnosed with cancer, with prostate cancer, it is too late because it has spread and caused a lot of problems. So in the early stages, no specific symptoms, and this is why screening is very, very vital. All right? It's just like breast cancer. When a lady's breasts start looking like orange skin, it's far gone. But if you check yourself and you feel a little lump, when it's just a little lump, you can get rid of it. Same thing with the prostate. If it's checked regularly, you can detect it when it's small and treat it early. So screening is very important. Don't sit and wait for symptoms. It will be too late when symptoms appear. So what are some of the ways in which we screen patients for possible prostate cancer? And just to mention that one of the other problems we have with the prostate is that the prostate gets larger with age. It just keeps growing. And that kind of growth is not necessarily cancerous, and it's referred to as BPH, benign prostatic hyperplasia. It just means that the cells in the prostate have increased in number, but they are not cancerous. But even benign prostatic hyperplasia will cause problems because we know that the urethra passes through, so if the prostate gets big, it's going to block the passage of urine. So the DRE, the digital rectal examination that men are so afraid of, And it takes about 30 seconds. And I tell the men, would you trade 30 seconds of a little discomfort for 3 months lying on the bed in severe pain to the extent that you ask God, please don't let me wake up because the pain is unbearable? It's better to deal with the 10, 20 seconds of little discomfort and go home satisfied that, okay, my prostate is doing well. All right, so what we check for is to see if there's any hard areas. So normally, the prostate should be nice and uniform. So men, if you should feel your hand here, so do your fingers like this, and just feel right here, it feels nice and soft and spongy. That's how the prostate would feel. If I'm feeling something like this, then something is wrong. I'm not supposed to feel any hard thing. It's supposed to be just nice and spongy like that. So the DRE, we're looking for any irregularities, loss of the median groove. I'm going to tell you what that is in a minute. All right? Any palpable nodes, any hard areas suggest cancer and should be investigated. We also look for the size, the volume, and other little issues with the prostate. So that's the position we would put the patient in. And I just tell the men, lie in the bed and curl up yourself like it's a cold winter night. And you don't have a blanket and you have to curl up like that to keep yourself warm. So you're curling up like this. And the doctor or the practitioner will put on a glove, put on some lubricating jelly on the finger, and we'll push that finger in the rectum, and we're able to do that and get a sweep of the prostate. Now, when we put the finger in, the prostate is supposed to have a thing called a median groove. So it's almost like I'm doing that and feeling between two fingers. When I feel a median groove, it suggests that your prostate is healthy. When the median groove disappears, then that is reason for concern. So this is something that you don't have to pay extra for. And it's your right, men, to ask your doctor to do a DRE. It's your right. As opposed to going and spending money to do a blood test. Well, thankfully, the government now subsidizes it. So you can do your prostate-specific antigen level. Now, there's some controversy about the PSA, but the normal range of your PSA is between 0 and 4 nanograms per milliliters. And I put normal in quotes because it depends on your age. So if I am 50 and my PSA is at 4, that's not a good sign. I'm not supposed to have a PSA that high at 50. I should be more like 1 point something, less than 2. So if I'm in my 40s and 50s and my PSA is 2.5 and more, then that's something to be concerned about. If I am in my 60s and my PSA is greater than 4 nanograms per mils, then that's a reason for concern. Now, so you have to look at it in an age-specific way. You also have to look at how fast it rises. And men, when you go to the doctors, I can't overemphasize this. When you go to the doctors, don't let the doctor just tell you that your prostate result is fine. Ask for the number. Just like the hypertensive and the diabetics. Ask about your number. Because you could go to the doctor this year and your PSA is at 1. And next year you do it and your PSA is at 3.5. The doctor will think, okay, it's still less than 4, so he's good. And the doctor tells you that you're fine, but you're not fine. Because it should not have risen that fast in 12 months. So you have to keep track of the number for yourself, all right? There are some false positives. So if you have benign prostatic hyperplasia, a large prostate, then you'll have higher levels of PSA in your blood. If the prostate has been irritated, so I'd like to tell the men, when you're going for your PSA, please don't ride a bicycle, because the prostate is so close to this region here, and simply riding the bicycle massages the prostate and puts more PSA in your blood, so it will give you a false positive. And you get alarmed and think you have prostate cancer when it's just a bicycle. And husbands, or the exercise machine, anything that is going to massage that area will increase your PSA and give you a false positive. And for the husbands, we tell them that when you're going for the PSA, at least 48, 72 hours prior, no intercourse, all right? So abstinence, because intercourse is going to cause your PSA level to rise. If you have an infection in the prostate, that can cause it to go up too. And sometimes patients can be on medications for the prostate, and it causes the PSA to fall. But it's a false negative. If it weren't for the medication, then you would have a true reading. So these are things that we have to take into consideration when we are testing. All right. I'm going to move on here. So once you're getting into the 40s, men, it's time to discuss prostate health with your doctor. And ask the doctor to do what's the name of it? Digital rectal examination. All right, a DRE. It costs nothing more than your regular bill for seeing the doctor. And when you combine the DRE with your PSA, you get two readings that give you double the information about the health of your prostate. So you do your DRE, but you also do your PSA. And you keep track of the numbers and make sure that it's not rising too fast. And have a healthy chat with your doctor. Sometimes, and I've had these cases where I've sent men to do their PSAs and it came back elevated. And when I questioned if they were having any symptoms, I realized that they were having symptoms suggesting that they had an infection around the time. So the PSA came back at 7.5. So knowing that an infection irritates the prostate and causes the PSA to be elevated, I just treat them with some antibiotics, and 3 weeks later, I do the PSA, and it comes back 2 point something. All right, so these are some of the things to take into consideration. So we take a history, and we dig into your family history. Doctor like to, get personal in your family business. We do a DRE or PSA, your blood count, kidney function, all of those things we do. If we suspect that you might have prostate cancer, we refer you to the urologist, who will further evaluate you and decide if you need to get a biopsy, where they will use a special probe and insert it through the rectum and pinch off pieces of the prostate and send it to the lab, where the technician will look at it and determine the health of the cells in the prostate. Now, if it has spread, then like men, I remember this gentleman who came to me, and when I looked at the docket, it said weight loss for 6 months, loss of appetite, and weakness. And when he walked through the door, a voice just said to me in my head that this is prostate cancer. And when I went further into the information, he had been having back pains. And when I examined him, he was maybe about 40 pounds less than his ideal body weight. So he was really, really skinny. He looked very pale. And I was so convinced that even before we did the test, Just by doing a DRE, I was able to tell him that this is the situation. But the gentleman left the office smiling. Because in addition to giving him that news, I told him what he could do to improve his health. And I wrote some iron tablets and sent him home. And when he came back for review, he was looking nice and pink and had put on some weight. So I said, oh man, you got the iron tablets? And he said, no, doc, I didn't buy them. So what have you been doing? He said, exactly what you tell me to do. I've been blending all kind of green bush. He was blending even Spanish needle. All the green bushes he could find, and beetroot, and he was using his garlic and his tomatoes and his pumpkin seed. And he died because of complications. Because when I saw him, it had spread to the bones in his back. And one day he was at home watching the TV, and he got up to punch a button on the TV, and then went back now to sit on the hassock. But he underestimated the distance, and he ended up falling on his bottom. And because the bones were so fragile, it just chopped the spinal cord in two, and he lost the use of his legs. And from that, he got depressed and everything. But if it weren't for that, he would have outlived all the prognosis that we could have given him, just simply by taking care of his health. So quickly, as I have about 5 slides left, let's just look quickly now at some of the general symptoms that could indicate that something is going on with your prostate. And I'm going to go through them quickly. So men, we know when we were younger, we could stand here and pee in the toilet bowl way out there. Right? I remember as a young boy, we would all line up and we would see who could pee the farthest. But then as you get older, you realize that you have to go closer and closer to the bowl because the stream is not as powerful as before. And that's because the prostate is getting bigger and the passage is getting narrowed, so the force is not as great. So when that is happening, it's an indication that the prostate some obstruction is going on there. It could be cancerous, it could be non-cancerous enlargement. Hesitancy. So men, you go to the bathroom, you feel like you want to pee, but you have to stand there like about 30 seconds to a minute before the urine finally comes. Right? So you get that problem with starting, even though you feel like you want to go. You have to strain to get the urine out, and you might find that your urine will flow and stop and flow and stop, so you get this intermittent voiding of the urine. You will find that for you to get all the urine out, you have to literally be squeezing to get the urine out. And you might not even get everything out. So you leave the bathroom and it feels like something is still there, but you can't quite get it out. So you have incomplete emptying. And when you get to the end of the stream, it doesn't just shoot and stop, but it dribbles at the end. Those are things that will suggest that the prostate that passage is becoming obstructed. Other things, irritative symptoms, you'll be going to the bathroom more frequently. In the nights, you'll have to get up to go to the bathroom a lot more frequently than before. So you have a general increase in frequency. I've had patients in the office and they say, Doc, can I go to the bathroom? And before they can go through the door, you can see the pants front is wet. That's what we call urgency. When they need to go, they have to go. They can't hold it. And you'll find, so you wet yourself. Urine burns when you're passing it, and sometimes you might have problems stopping it. And the time you take to pass your urine is a lot longer than usual. So to summarize it, early in prostate cancer, there are no specific symptoms. When you get to the later stage of prostate cancer, When the cancer is now causing obstruction, you begin to have the obstructive symptoms and the irritative symptoms. You might have constipation as the prostate grows into the rectal area and begins to block the passage of stool. And that's pretty advanced. You find blood in the urine, blood in the ejaculate, weight loss, anemia, a low blood count, lower back pain, and as I told the gentleman, you can become paraplegic because it has spread to the bones and caused your spinal cord to be severed. Now, if there's blood in ejaculate, you need to see the doctor. Something is wrong. If you are passing blood in your urine, you need to have it checked out. If you're having this constant pain right down where your body would rest on a bicycle seat, some men you can imagine, right in that little area, if you have this constant pain right there, it's usually a pain that comes from the prostate. So it's your body telling you that something is going on with my prostate, and you're actually feeling it there. All right, so we're going to go past that, and I'm going to close with this slide. What are the preventative strategies? I'm not here to push any medications. We're here to push God's way to health and happiness. So we have the new start, and my brother there spoke of that earlier. So proper nutrition, exercise, clean water, sunlight, temperance, fresh air, rest, and trust in God. And we have the other one, which is celebrations, which basically covers the same topics. So generally speaking, I should not, once I'm 40 and over, I need to have a chat with my doctor regarding my prostate. We get that right? I'm summarizing now. Prostate cancer in the early stage will give no specific symptoms. Therefore, screening regularly is very important. Don't wait for symptoms. Yes, I might be genetically predisposed to having prostate cancer, but that does not put the curse on me that I must have prostate cancer. How I live and how I take care of my body will determine how the genes actually play out. What are some of the things that I should be including in my diet as a man to ensure that I have a good prostate health? My tomatoes, rich in lycopene. My pumpkin seed, rich in zinc. My walnuts, my Brazil nuts, my chia seeds, my flaxseed, my papayas, my guavas, my pink grapefruit. What are some of the other things? My beans, my nuts, my grains, all of those things. My water, because many people have constipation and they are vegetarian, so they eat a lot of vegetable, but they are constipated because they're not drinking enough water and not exercising. You know that if you're lying in bed, you basically will end up with constipation just from inactivity. So having regular exercise is stimulating to the gastrointestinal tract. And we know that anything that stays in your GI tract for too long is going to increase your risk of getting cancer, because those things will be reabsorbed in your body and will increase your risk of prostate cancer. But if we follow God's plan, His New Start plan, or the celebrations plan, then we can help to ensure that we will live long, healthy life, and better quality of life. It's not just about living longer, but it's also having a better quality of life. And we might look at the fact that C.D. Brooks died of pancreatic cancer, and he was a vegetarian. But if he had not been a vegetarian, quite likely that would have happened earlier in his life. The man died when he was about, 85, 86? Yeah, a ripe old age. So it makes a difference. You might end up with some of the diseases of the Egyptians, but you end up with them much later in life. And you don't basically, you can lie on your bed and literally call your children around and bid them goodbye and close your eyes and have a nice death, if there's such a thing. All right? But there's such a thing. We read in the Bible where David slept with his fathers, Abraham slept with his fathers, and Jacob just blessed the guys and closed his eyes and said, bye-bye, see you in the morning. That's how it should be. Not lying on a bed, praying for death to come, but welcoming death, because we know that the next voice we will hear will be that of our loving Savior calling us, calling his children home. All right, so that brings me to the end of the presentation. I think I've gone about 15 minutes over the time. Sorry about that, but it was a lot to pack in. All right, so just a few questions. Yes.
Yes, the text you presented in Exodus, where the Lord said, if we would take heed, his people would take heed unto all his commandments and the precepts, and so all of these diseases would not come upon them.
Yeah.
Is prostate, development of prostate cancer, is it something normal? Is it something, have I missed it, that probably there's something we have been doing or something we have not been doing that have led to that eventuality? Or what? I would like some more clarification.
Okay. So we have cancers because of sin. That's the underlying problem. Because of sin. We have all of these diseases. But in the midst of it, God has given us a plan to help us to delay the onset and even avoid these diseases. But sin is the reason. And when the atheists and the creationists, they have their discussions, they always come down to that thing. How can a good God just sit around and watch people suffer like that? But it's not his doing. It's Lucifer's doing. And all of this, Lucifer coming down to Eve and to Adam, and we are under the curse. So it's because of sin, sir. That's the main problem. And then we have sin as a problem, but then if we don't take care of the body, as God said we should take care of it, then we are calling down some of these things on ourselves. All right? Yes.
Doc, is there an order in which the test should be done? Say the PSA first. If you're doing both at the same time, the PSA and then the DRE, or the DRE and then the PSA, is there an effect of one on the other?
Yes, there's an effect. You should not be doing your PSA on the same day that you do a DRE. Because the doctor's finger, the practitioner's finger, stimulates the prostate and can cause a false rise. So there should be enough separation, at least a week of separation between your DRE and doing the PSA, to avoid the problem of the doctor manually stimulating the prostate and causing the rise. Yes. Yes, maybe a
commercial.
Okay, no problem.
Is preventing prostate if you're underworked or overworked?
All right. The jury's kind of out on that one, because there's one camp that says, working it adequately lowers the risk then. So remember, New Start has T in it, temperance. In all things you must be temperate. So if you hear that, yes, when it's active, it lowers the risk, it doesn't mean that you're going to abuse that, thinking that if I step up the game, I'm going to reduce the risk lower. You're going to end up causing more problems. Because logically speaking, overworking it can lead to increased risk. If you look at it from a physiological and a biochemical point of view. But they said for a normal healthy lifestyle and normal healthy sexual relations, it's actually beneficial. And if you're not married, you have the other things, you have the lycopene and the zinc and all of that to keep you healthy. The underwork? Well, temperance is important. But as I said, the jury's out on whether they're overworking or underworking of it. But as I said, from a physiological point of view, abusing it will be problematic. So you just need to have a moderate, healthy sexual life. And you should be good with that. All right, thank you. I think that's all the questions.
Underworking it. The fact is, if you are not married, you can't work it. You understand?
Yeah, we shouldn't.
So right. So I don't see why God would say, if you're not married, then don't do this. And then cause you now to, compromise, to be compromised. So I think there's more safety in underworking. That's what I would think.
All right. And I would just add by saying that the fact that we say a healthy sexual life is beneficial doesn't mean that you should go and take up things that you're not ready for. All right? Or doing things that God has not permitted you and ordained for you to do. Whether you are married or you are single and abstinent, God has provided ways for you to remain healthy. And I have known men who were never married and from all appearances were faithful to God, and they lived to a nice ripe old age and die of other things. So we just need to follow God's plan, and He will take care of us. Thank you very much. We might have to leave. Sorry we have to leave, but circumstances forces us. But thanks for the invitation, and it was good meeting up with you guys again. And I hope when I say I'll see you soon, as one friend says, there won't be a lot of O's between the S and the N. All right, thank you.
Okay, thank you, Dr. Newman. And to say thank you in a more tangible way, we invite Sister Wall, who will come and do a presentation to Dr. Newman. Could we put our hands together for Dr. Newman? Let me see the hands of those who did not learn anything. Okay, so we all learned. I am looking online, it's streaming on YouTube, and I see persons watching all the way from Guantanamo Bay in Cuba. Just want to say thank you, Chris Foreman, for joining us, and he's saying that the presentation is very informative.
Good evening, everyone. Dr. Newman, I would like to invite you back up here. I would like to thank you, Dr. Newman, for this informative presentation and educating us on the vital importance of prostate health and avoiding prostate cancer. Please accept this gift on our behalf.
Okay, due to the interest of time, we will be having part 2 next week. So for those presenters who did not get the chance to do their presentation this week, we will definitely be having the presentation, but it might be next week or the following week based on time, because you know AY don't really have a lot of time. So I crave your attendance and your support as we continue to do our health presentation. At this time, we will have Miss Nesha Forbes. She's the assistant nutritionist at the Mandeville Comprehensive Health Center, and she'll be doing a demonstration and our presentation on what's on your plate. What's on your plate? All the colors on your plate. Yes, right. And some persons say food on the plate. All right, so we'll learn more as to what is supposed to be on our plate. Let us say a big amen as we invite Miss Nesha Forbes to come and do presentation.
Good afternoon, AY. It's good to be here. Thank you for the invitation, my coworker, Mrs. Ellis. All right, so Dr. Newman, you set a good foundation for my presentation this afternoon. The topic of my presentation is Eat for Health and Vitality. The outline, we'll be looking at the prevalence of non-communicable diseases, or NCDs, and the role that nutrition plays in fighting these illnesses. We'll be also looking at the role of the food-based dietary guidelines for Jamaica, the benefits of nutrients within food groups, differences between portions and serving sizes, how to make healthier food choices, and I'll be sharing some healthy eating tips with you as well. So, what are the NCDs? What are non-communicable diseases? These are known also as chronic illnesses because they tend to happen over a long duration of time, and they tend to occur based on a number of factors. Could be genetic factors, as mentioned, physiological, your environment, or your behavior that influences your getting an NCD. There are these are the main NCDs: cardiovascular diseases, which includes disease of the heart and the blood vessels, and those include hypertension and heart disease. Diabetes, we know this one as sugar. Some cancers, including colon, breast, and of course, prostate cancer. Respiratory illnesses, those diseases of the lungs and the airways, for example, asthma, and also kidney diseases. So these are the main NCDs. In terms of statistics, worldwide, NCDs account for 41 million deaths each year. Each year, 17 million people die from an NCD before they reach their 70, before the age of 70. And of all the NCD deaths, 77% are in the low and middle income countries. And we know that Jamaica is a middle income country, right? In terms of our regional and local statistics, in the Caribbean, NCDs are the leading cause of death and premature death and disability. And in Jamaica, 4 out of 5 individuals, or 80%, die from an NCD. So despite us having the road fatalities, despite the crime and violence, NCD continues to be the leading cause of death in Jamaica. Can you imagine? All right, so there is a great burden on the health system. We can see it reflecting in the clinic settings. We can see it reflecting in the hospital settings, the amount of persons who come to seek care and treatment. What are the 5 main risk factors for developing an NCD? Of course, an unhealthy diet, excessive use of tobacco, air pollution, harmful use of alcohol, and being physically inactive. So what is an unhealthy diet? Typically, an unhealthy diet is one that is high in salt, high in unhealthy fats, high in processed foods, and low in fruits and vegetables. Of course, this unhealthy diet can lead to elevated blood pressure, elevated cholesterol levels, bad cholesterol that is, obesity and insulin resistance. And therefore, nutrition is one of the key players in prevention and management of NCDs. This is according to the World Health Organization. So now, how does nutrition, what are some of the strategies that nutrition we can apply in terms of nutrition to combat the NCDs in Jamaica? In 2015, the Ministry of Health and Wellness developed food-based dietary guidelines. Anybody is familiar with the food-based dietary guidelines for Jamaica? Have we ever heard about it? No. All right. Maybe when you see the picture, you might be, you might change your mind. But the Ministry of Health and Wellness developed the food-based dietary guidelines for Jamaica in an attempt to reducing the chronic disease burden, reducing the micronutrient deficiencies such as anemia, and an attempt to increase our intake of fruit and vegetables by promoting healthy behaviors and practices. It also promotes variety in the foods that we eat, adequacy in the foods that we eat, and balance. And the food-based dietary guidelines for Jamaica is applicable to persons greater than 2 years old. This is what it looks like. Still not familiar with it? Yes. All right, so it is typically illustrating a plate. As you notice, the fruits and vegetables account for basically half of the plate, right? So we get mainly our vitamins and minerals from our fruits and vegetables. Dr. Newman stressed the importance of vitamin C, D, E, and some others to help in warding off cancer of the prostate, right? So it is important to incorporate our fruits and vegetables on a daily basis. If you notice the fats and oils, right? You notice this is the fats and oils section. You notice how small it is? So it's indicating that we should have our fats and oils in the smallest amounts, especially the unhealthy fats, those mainly from animal sources. And we have the other food groups being represented. We have our staple groups. We mainly get our, what we refer to as our starches. This is our staple groups. Legumes. This incorporates our peas, beans, and nuts, and food from animals. And of course, in addition to healthy eating, we're encouraged to be physically active and up our water intake. So there are 8 guidelines, and these are as follows. Eat a variety of foods from all the food groups daily. When we incorporate variety, we are more likely to cover a wider cross-section of nutrients. So variety in color, variety in texture, variety in taste, we're able to more than likely cover more nutrients than we normally would without incorporating variety in the diet. We're also encouraged to eat a variety of fruits daily, a variety of vegetables daily. I know with the passage of the hurricane, the prices of the fruits and vegetables have gone, they have skyrocketed, right? So it's hard on us in the nutrition department to encourage the clients to eat their fruits and vegetables. However, we encourage those persons who can set up a local backyard, drop 2 seeds, and see if you can supplement your kitchen as best as possible. We also encourage fruits and vegetables that are in season to incorporate those and those that are local, because the ones that are imported are more costly. All right? We're also encouraged to include peas, beans, and nuts in our daily meals, and while reducing our intake of salty and processed foods, reducing our intake of fats and oils, reducing our intake of sugary foods and drinks, and incorporating physical activity in our daily routine. So by definition, as I mentioned before, nutrition plays a vital role in fighting or managing the NCDs. And so by definition, we know that nutrition is the process of consuming and absorbing foods and nutrients, and the nutrients that are derived from those foods help in the growth and development and the maintenance of life. Where do humans get their nutrition from? Where do we get our nutrition from? Food, right? And food is any substance that contains energy and nutrients, which when we eat them, they nourish the body. Hence, what is a nutrient? Any chemical substance that we get from food, which when used by the body provides energy, maintenance, and repair of body tissues. And there are two main classes of nutrients. There are macronutrients and micronutrients. So as the name suggests, macronutrients, these are the larger nutrients, the carbohydrate, protein, and fat. And their main function is to provide the body with energy in the form of calories. We've heard about calories, right? The protein serves as the building blocks for the muscles and tissues. And for the micronutrients, the 2 main micronutrients are vitamins and minerals. Though we need the vitamins and minerals in smaller amounts, they are important for bodily processes. They help to protect and promote various bodily functions, including processing energy from the bigger nutrients. So if it is that we're having our carbohydrates, our proteins, and our fats, and we're not having adequate amounts of vitamins and minerals, you'll find that there's slowed weight gain, and so on. Vitamins are also further divided into water-soluble vitamins and fat-soluble vitamins. So there are some vitamins A, D, E, and K, that we need fat in order for it to be absorbed in the body. So fat has a place in the body or in the diet. Water, although water is defined as an essential nutrient because it is needed in the body in amounts that the body cannot provide or produce on its own. All right, so it is classified as an essential nutrient, and all chemical reactions occur in water. Digestion, absorption, transportation, assimilation, all of them occur in water. Cannot do without our water. So there are 6 food groups. Can we name them, or kind of dark? The 6 food groups are staples. Persons normally refer to staples as the starches. So this food group incorporates all the ground provisions, the rice, the breads, the macaroni, the oats, the corn. All of these are staple foods. Food from animals, as the name suggests, any food item that comes from animal source, and that includes dairy products and seafood as well. Legumes. Legumes is the broad term for peas, beans, and nuts. So you'll find peas, beans, and nuts in the legumes group. Fruits, vegetables, and fats and oils. So we're just going to go through quickly the nutrients and the functions from each food group, and then we'll move on. Staple group, the main nutrients derived carbohydrate and protein, and we need these staple foods to supply the body with energy, especially for the diabetics. Yes, you should eat your staple foods, because if you do not eat your staple foods, you will not have adequate energy to carry you throughout the day. Legumes, main nutrients derive protein and carbohydrate. Yes, we do get carbohydrate from peas and beans as well. And they supply the body with energy, build and repair body tissues, and supply fiber. Fruits and vegetables, the main nutrients are vitamins and minerals. And the function includes to help build bones and teeth, helps in building the immune system, supplies the body with energy, helps to fight off infections. Food from animals, the main nutrients, proteins, vitamins, minerals, helps to repair bones, helps to repair body tissues, and fats and oils supplies fats as nutrients and vitamins as nutrients, and helps to supply energy, repair cells, and provides needful covering for our body cells. As I mentioned before about water, it is an essential nutrient and it has a variety of functions. We know that more than half of the body is made up of water, more than 50%. And so some of the functions of water is to maintain blood volume. We know that? Yes. It helps in regulating the body temperature. The time is very hot now. So we do need water. And we need it for hydration as well. The sugary beverage will not quench the thirst. It actually makes you more thirsty. So you need water to actually quench that thirst and keep you hydrated. Water is responsible for all the metabolic reactions in the body. And we need water to transport the nutrients into the cells and to move waste away from the body. So maybe we have heard the terms servings and portions. We may have an idea. We may know what it is. Some may not be so sure. So we're just going to go into servings and portions, and I'll give some examples of what a serving is from each food group. What is a serving? A serving is a standard measurement. It doesn't change. So a mile is a mile, $1 is $1, one serving is one serving. All right? So a serving of food, for example, a serving of staple or a slice of bread is considered to be one serving. Half cup of rice is considered to be one serving. Therefore, what is a portion or what is portion? The portion is what you choose to eat. So the servings from each food group comes together to make up your portions. So if you think of the analogy of dollars and cents, the unit cost would be the serving, and then the total cost would be the portion. So when you put all your servings together, it makes up your portion, and that is what you choose to eat. For example, when mango season comes, and one green skin mango, see how small it is one serving of mango. But suppose I want to eat 6 one time. That is my portion. So I put 6 servings together to make my portion. I'm not saying it's necessarily the correct way to go about having the mangoes, but I just wanted to get the understanding, all right? So when you put your servings together, you make up your portions. All right. So how do we know what amount of serving of each food group to have per day? Staple group, remember the staple consists of all the ground provisions and the rice and so forth. An individual can have anywhere from 9 to 15 servings of staple food per day if you're on a 1,600 to 2,800 calorie diet. Now, in order to know what your caloric intake should be, you would have to be clinically assessed by a registered nutritionist or a dietitian, because there are varying factors that will determine what your caloric intake for the day should be. Genetic, age, your biochemical information, meaning your lab results, your level of physical activity, whether or not you have any chronic illnesses. So we would sit with the client and we would do a thorough assessment to determine what your calories should be for the day. and we do a meal plan or a nutrition prescription for you. All right? So for the staple group, 9 to 15 servings per day is recommended. For the legumes, 3 servings per day. Food from animals, anywhere from 3 to 7 servings daily. Vegetables, 2 to 3 servings. Fruits, 2 to 3 servings. Fats and oils, 5 to 6 servings per day. In addition to your food from animals, you can have 2 to 3 servings of milk per day. If it is that the vegetables that you're consuming is raw, or the vegetable is non-starchy, because you do have some vegetables that have starch in them, right? If it is that the vegetable is raw, or it is a non-starchy vegetable, you can have any amount as you desire, all right? Just ensure that you're still having balanced meals. When it comes on to added sugar, and in this case, added sugar means not just the table sugar, tang, condensed milk, molasses, syrup, Milo, cocoa, all of them are considered to be sugar. It does the same effect on the blood glucose as would table sugar. So when considering your sugar intake for the day, and the recommendation for females is 6 teaspoons of sugar per day. This is the size of 1 teaspoon. See how small it is? All right. And for the males, 9 teaspoons is recommended for the day. It doesn't necessarily mean that you have to use up the 6 teaspoons as a female or the 9 teaspoons as a male per day, because you should still have to watch your sugar intake overall. All right, so let us look at some examples of a serving of staple. So rice or rice and peas, half cup is 1 serving. Remember, how many servings you can have per day of staple? Suppose you're having rice. You can have anywhere from 9 to 15 servings of staple food per day, right? So remember, the half cup is just 1 serving, you know. So let me use myself as example. Suppose, let me start at the lower end. Suppose, based on my individual needs, I'm required to have 9 servings of staple food for the entire day, right? So for breakfast tomorrow morning, you can divide the 9 servings into equal amounts throughout the day, right? So tomorrow morning, I want to have bread for breakfast. 1 slice of bread is a serving, right? But I've divided it into 3 for breakfast, 3 servings of staple for breakfast, 3 servings of staple for lunch, and 3 servings of staple for dinner. So I can have 3 slices of bread in the morning. 1, 2, 3. Suppose in the day I plan to eat some rice and peas. 3 half cups, right? It will look a bit? All right, so remember I start at the lowest end. Remember I start at the 9, which is the lowest end, but you can have 9 to 15 servings of staple food per day. I see a hand around the back. Yes, remember I mentioned before, you will have to be assessed individually because there are varying factors that will determine your calories, which equates to your portions per day. So I did mention your level of physical activity, gender, whether or not you have underlying illnesses, etc. So you have to be assessed on an individual basis. Just as how you'll find persons seeing the doctor. You have many persons who are diabetic, but they still have to do the one-on-one with the doctor. They may be on the same medication, but the dosage might be different. So it is with nutrition counseling and assessment. It is an individualized thing. So based on the fact that you're a construction worker, I'd have to see you individually and work out your calories to see how much servings of staple food is needed for you for the day. Question answered? All right. Let's look at the flour. 2 tablespoons of flour. How big do we make our dumplings? I put that there deliberately. All right, so when we're making, what we call it now, cartwheels, we couldn't count that one dumpling as one serving now. It's more than one serving in the big dumpling, based on the standard measurement of a serving. No, no man, you can add more than one serving of flour to make up the dumpling. It depends on the size. Yes, it can equate to that, yes. All right? Let's look at it can't go work. If you put 4 tablespoons, that is 4 serving of starch. How you need it? You can use a small spoon and help you to knead it. If I him alone. Right. And the green banana medium finger is 1 serving. Yes, sometimes the banana them small and soft. So it's not so serious. You can put 2 small finger banana to make a medium size. So it will vary. It depends on what is happening in your household, because some finger banana are really small. All right. Yes. All right. Did you know that if you're on the hospital ward, it's a standard amount of food that you get? You're on a 1,800 calorie diet, and that's like 3 servings of starch per meal when you're in the hospital. With the exception of persons who are on special diets, who may require more. So as I said before, it is an individual thing, individualized, personalized thing where we'll have to work out your meal plan for you based on what is happening with you. So these are just general guidelines. Let us look at the food from animal group now. 1 medium egg is 1 serving. But remember, you can have how many servings of food from animals per day? 3 to 7, all right? All right. If it is canned fish like sardine or tin mackerel or tuna, 1 can typically has 2 servings in it, 2 to 3 servings. All right? If one sardine. If it is the small tin mackerel, it typically has 2 servings in the tin. It doesn't necessarily mean that you have to eat it twice, because suppose what I prescribe for you for a particular meal is 2 servings or 3 servings of food from animals. You can have, if it's 2 servings I've prescribed for you for a particular meal, you can have the entire tin with the 2 servings in it. So it depends on what I prescribe for you for each meal. Even though I'm showing what 1 serving is from each food group, it doesn't necessarily mean you're going to eat 1 serving of the particular food or food group at each meal. It's a combination that will be prescribed for you. Remember, that's why we have the ranges of the daily recommended allowances per day for each food group. Following? All right. 1 drumstick, a small one, is a serving of chicken. 1/2 cup of milk is a serving of milk. Now remember, I had mentioned the food-based dietary guidelines, right? Most of the canned items tend to be high in salt, and so just a timely reminder to reduce your intake of salty and processed foods. If you do not have to use up the tin items frequently, you can substitute with other low salt items. All right. Fruits. I've been sending around some pictures with the serving sizes. Are we looking at them? Not the black and white sheets, the pretty ones. So you can share it. Question? From nature. The example I can draw for that is what is added when you cook it. So remember I said that if let's use a vegetable as example. If the vegetable is, if 1 cup of cabbage is a serving, sometimes when we cook it, we add fat in the form of oil or butter. So it increases the calories. So that's why when I said when it is cooked, it has to be less than the 1 cup. All right? It shrinks, but you add calories in the form of fat. That is if you steam your vegetable with oil. Any further questions? Remember you're adding calories, and you're prescribed a certain amount of calories for the day, or your recommendation is a certain amount of calories for the day. So if it is you're adding additives to the particular food item, it will increase the amount of calories in the food. Let's look at the fruits. Half of a grapefruit or orange, depending on the size, medium, is a serving. Fruit juice, if it is concentrated, we have the fancy things now, the juice extractors and so on. Half a cup of unsweetened fruit juice is a serving. Half cup is 1 serving. This is half cup. But remember, when it comes on to fruit, you can have 2 to 3 serving of fruit for the day. All right? 10 guineas is 1 serving. So I put that there deliberately because I know some of us love the guineas. So 10 guineas is 1 serving. And I put coconut water there deliberately as well, because sometimes we don't consider coconut water to be a fruit, but coconut water is in fact a fruit juice. It has 6 teaspoons of sugar per serving. So we use up all the 6 teaspoons as females in 3/4 cup of coconut water. So imagine we're drinking our 3 jellies for the day. So it's not water. There's nothing that replaces water. Water is water. Coconut water is a fruit juice. It's a natural fruit juice. and it's so funny because you can see why we're having so many chronic illness in Jamaica, because we are unaware of some of these things. All right, so we tend to go overboard, thinking that, okay, I'm eating healthy. But even though it's natural, coconut water is natural, too much of one thing is still good for nothing. So we have to practice temperance, as Dr. Newman mentioned before. I should mention though, wherever you see cup, if you don't have these fancy things at home, you can, 1 cup is the same as a small size chiffon butter dish, right? Or it's also the same size as one of the small 8-ounce soup cup. Right, so if you don't have the fancy things at home, you can use those as measuring tools to ensure that you're not going over the required amount or you're not going under the required amount. All right, so wherever you see cup, you can use a chiffon dish to measure, the small size chiffon dish. So you can have 2 to 3 servings of any fruit per day. And most times, even though we're arguing about the juice and the coconut water, sometimes we're really not eating any fruits at daytime, It's true. All right. All right, and we're reminded, based on the food-based dietary guidelines, to eat a variety of fruits per day. Sometimes we pass and we see the papayas falling off the tree. We see the apples rotting on the tree and falling off. We see the bananas spoiling and the bird eating them. We're not eating. We see the guava, them spoil. So we have all these fruits around us, but we're not utilizing them. If it is that, you can have your fruits in a variety of ways as well. If it is that you're out and the dessert is pastry that is offered and there's a fruit option, you can take the fruit sometimes over the pastry, which is healthier. If it is that you have an issue drinking water, because sometimes some people don't like to drink water, you can use the fruit in your water and infuse the water with your fruit. So it gives the water a little flavor, and you're also getting some vitamins and minerals when you do that. Some people use herbs like mint in the water, or vegetables such as cucumber to flavor their water as well. Legumes. What is a serving of legumes? Let's look at the peanuts. 16 whole shelled peanuts is 1 serving. Cashew. Let us look at the cashew. 7 whole shelled cashew, just 7 is 1 serving. Half or quarter cup of cooked peas and beans is 1 serving. Remember, you can have 3 servings of legumes per day. One way to get the legumes in especially the nuts, you can pair it with your fruit when you're having a snack. Let me take her first. It remains the same. However, I would have to individually assess you to know what your requirement is for of protein per day. Yeah, man. Remember, a serving does not change. A measurement does not change. However, I will have to calculate your nutrition prescription in the form of calories to know how much serving of legumes and nuts you will require to meet your protein intake for the day. It doesn't matter if you're a vegetarian or you eat food from animals. The calculation of your calories is totally different from these general guidelines. Once you are prescribed a certain grams of protein, we calculate that to ensure that you're meeting that requirement for the day, coupled with other factors, your activity level and all of that. Answer your question? Kinda? Use them. You can use them.
So the fact that you'd be eliminating one food group altogether, it doesn't indicate an increase in another food group that would provide the nutrients.
All right. So food from animal, the 2 main nutrients are fats and protein, right? So fats and oils, 5 to 6 servings per day. So we would stagger that for you to meet your requirement for the day, and we would stagger the protein, the grams of protein for you to meet your requirements for the day.
So that our other protein sources would increase?
The sources would increase, the calories would increase. Yes, so if the calories increase, the number of serving per meal of protein would increase.
Okay.
Yes, the grams of protein per meal would increase. And fat too, because we don't get fat from legumes, with the exception of the nuts, right? So let us look at the vegetables. I went over some of this already. 1 cup of cabbage cooked is the recommended daily allowance. However, if it is raw, you can have it you can have it as desired. Same thing for the tomato, and 1 cup of chocho cooked is a serving. Remember, the tomatoes and the red pigmented fruits and vegetables, I'm coming to you, has the lycopene, which is good for the prostate.
Yes, to be honest, I don't think of how the plate is set up that you
can meet the requirements.
Right, per day. So, say for argument's sake, I got up this morning and I ate 3 slices of bread and a ripe banana, and I drink some water.
All right.
And in the midday, I
being so rigid at each meal. Yes, you can stagger it. As long as you're at the end of the day, you're meeting your requirements. However, be mindful not to go overboard by, if you minus the starch from 1 meal, you may go overboard with it on another meal. And you want to be moderate in the amount of staple food that you're putting in the body at once. But you can always stagger it throughout the day.
Yeah, one of the things I would want to say in response to her question about eating starch at this time or more vegetable at that time is that your body requires all those group nutrient groups throughout the day. So if you deprive your body at this point in time and then you eat all of that, the protein at that